Why is malar edema so important? I think it's because patients don't fully realize that if they get filler in their cheek, sometimes injectors place it a little too high in the cheek. Some patients actually get it placed properly, but they are prone to swelling in the lower eyelid. So they have a little too much swelling in the lower eyelid / upper cheek area. If you're one of those patients who are prone to having that, it doesn't matter what filler you have, although more robust fillers tend to create more swelling and more problems. Even if you get the proper filler and go to a great injector, you may have a lot of lower eyelid swelling or cheek swelling, which we call malar edema. The treatment is you may need lower eyelid surgery, and you are probably not a candidate for any type of filler at all. And it's my opinion that in fat grafting alone, you still may not be a great candidate for that. The reason why is there's a ligament here, the orbital-malar ligament, that creates this indentation, what's called the nasal jugal groove or the tear trough. But essentially, if you have an indentation, as we get older, you can more distinctly see the hollowing of the lower eye. There's a ligament that attaches the skin to the underlying bone. That ligament should be released to get rid of potential malar edema and also give you the best results. We do have to reposition fat over this area, which is internal underneath the skin, and we may have to do fat grafting, which fills in the indentation. And finally, we may have to tighten the skin either physically by cutting out skin, or we may have to resurface the skin with laser to give you the best results. Without getting too much in the weeds in such a short video, we need to focus on what's causing the swelling of your lower eye. And filling the area with filler hurts, and it doesn't help with lymphatic drainage and getting rid of swelling. Not all patients have this, but a decent minority of patients do, a pretty high percentage actually. And so you could be of any age, even quite young, but if you get filler, which in most patients would work, it may not work in you. So just be aware of this. If you have a history of serious sinusitis, allergies, puffy lower eyes, even at a young age, you probably should strongly consider not getting filler in that area. So now you know.